Another important topic we study is a squamous cell carcinoma. So let's start it. Bismillahirrahmanirrahim. So basically, it is the most malignant tumor of the oral cavity. If you can consider, it is the most common cancer of the body and most common malignant tumor of the oral cavity at the same time. Okay. The squamous cell carcinoma count for 90%. Adenocarcinoma is for 8%, and then sarcoma is for 2%. Okay. Now basically the lower lip which count for 30%, you can remember it like if I draw it lips for 30%, tongue is for 20%, and then you see that down is the floor of the mouth which is 15%. The mandibular alveus is basically 15%. The buccal mucosa is 10%, and maxillary alveus and palate is on 10%. It is due to either social habits, sometimes tobacco, which I have also told you in leukoplegia, alcohol, which I have also told you in leukoplegia, areca nut wrapped in a betel wine. Okay, this areca nut also causes the submucous fibrosis. Okay, so don't forget. It can also cause the squamous cell carcinoma. Okay, so social habits, alcohol, tobacco, areca nut wrapped it in a betel wine. Okay, it is wrapped it. Okay, now moving towards the which type of bacteria, fungal or viral causes this. If the patient is suffering from terticephalus, candida leukoplegia, which is fungal, and viral, you have herpes papilloma and HIV. Extrinsic factors, you have actinic radiations. I have also told you actinic chalices also. So actinic radiation, industrial hazards, you have chemical industry. Okay, you have poor hygiene and ill-fitted dentures. Okay, so infection in bacteria you have trachycephalus. In fungal you have basically candida leukoplegia. In viral you have herpes and papilloma and HIV. In extrinsic you have actinic basically radiation. Then you have industries like chemical industry, poor oral hygiene and ill-fitted dentures. Intrinsic factors is basically genetic, like dyskeratosis congenita is one of it. This dyskeratosis congenita also come in your those lesions that cannot be rubbed it off. Okay, number one. Second, it is a heredity white lesion, dyskeratosis congenita. Nutrition deficiencies, you have iron, you have folate, you have vitamin B12, and also immunosuppressant patients like leukemic patient, diabetes patient, thalassemia patient, immunodeficient patients. Okay, so what you have studied in infection, you have studied the bacteria which causes trachycephalus, and then in fungal you have studied the candida leukoplegia. In viral you have herpes papilloma and HIV. Extrinsic factors, what you have counted is for the actinic radiations, chemical industry, poor oral hygiene, and basically the ill-fitted dentures. Intrinsic factors are genetics like dyskeratosis congenita, nutrition deficiencies like iron deficiency, vitamin B12 deficiency, folate, and immunocompromised patients. Then clinical presentations. There are three stages of their clinical: early lesion clinical presentation, intermediate clinical presentation, and then you have actually this is the leukoplegia. Then you have advanced lesions presentation. Now moving towards the uh,